When most of us go to the doctor for routine or emergency care, we get a bill. Either in the form of a copay or a deductible, it's an unavoidable part of our health insurance system. Most of the time, these bills are expected and manageable for families. Surprise medical bills are different than expected. Surprise medical bills are an all too common problem when, through no fault of their own, families with health insurance receive medical treatment from an out-of-network provider. The surprise comes in the form of a doctor bill for the difference between what the provider charged and what the insurer pays that provider. This amount is often many times what the consumer's in-network cost-sharing responsibility would be for the service. The average surprise bill is more than $600, which is more than what 40% of families in the US would be able to pay without borrowing money or selling something. And these bills can reach tens of thousands of dollars. Most families just aren't prepared for the financial hardship of handling these additional costs. Surprise bills can arise in an emergency when the patient has no ability to select the ER, the physicians that treat them, or the ground or air ambulance providers, when a patient receives planned care from an in-network provider, but other providers are brought in to participate in the patient's care and aren't in the same insurance network. These can often include anesthesiologists, radiologists, pathologists, surgical assistants, and others. Since COVID-19 hit, these bills are becoming more common, as families who are experiencing health emergencies or seeking routine care are pushed to out-of-network hospitals and providers due to facilities being overwhelmed with COVID-19 patients. Plus, as families are being hit by this dual health crisis and economic downturn, and unemployment is higher than it's been in decades, there's widespread economic uncertainty, and families are less likely than before to be able to handle these unexpected medical bills. Many states have passed laws to protect consumers from these bills. However, these protections are patchwork and are not comprehensive. Even within those states that have acted, many families remain vulnerable. It's up to Congress to act and protect all families from this unfair and devastating practice. Congress needs to hear from you. If you've experienced a surprise medical bill, please consider sharing your story. Policymakers need to hear from you so that they put the needs of families above the frustrations of internal politics and special interests. Comment below to share your story, or go to nosurprisescampaign.org and click the Share Your Story link.